and you are able to download the bone list. Please affirm anybody has problem with that or you have not seen that list.
Is the bone list in the PowerPoint in Canvas?
Yes, I have linked the list in the PowerPoint and in the lecture too. So I will list there and I will separate upload too. It is in your study guide. It is in your the PowerPoint. It is in your lab video. Everywhere I have embedded them. Okay.
The PowerPoint didn't work for me, but it is on the study guide.
Oh, PowerPoint
that
you cannot download?
I wasn't able to see it on the PowerPoint link, but I went to
Okay, I will show you today. I will show you guys here.
Okay, thank you.
Okay, so, and I will upload that too, separately. It will be like 5 places. Everywhere you open this chapter, you will have that list. So what is the main factor here? For this bone or skeletons, you just study these list, bone list. This will work for both your lecture and the labs. Because in this section, we're gonna identify the bones. And we will identify the bone features. As you remember from the last lecture, there is a bone or there is a bone feature. Bone feature is a bump, a hole, or a rough surface or a smooth surface of the bone. And that is bone feature. So some of the bones you have know just the name. Some of the bone you have to know the names and the number. Some of the bones you have to know their names and the bone features. Okay. So I have printed out here all my bone list. And when I go over this chapter 7 and 8, I will focus only on the bone list. In my recorded video, also I have gone in your My Lab and Mastery, and I have accessed all the bones, and I have talked about only the bones which are in the list. Okay. And once we are done with the bones, the joints, the muscles, then I will post again the concise list of study guide for the lab for this midterm 2-2. So you will have like what to study for the next exam. Okay. But for now, study these material very rigorously. Okay. So if you have opened the bone list, I am going to open my bone list here first. So can you see my PowerPoint?
Yes.
Yes. So on the PowerPoint, you see here, there is the bone list. If you, it's a control plus click will open. So I'm clicking control and then you click it, it opens the bone list. What happened?
I think it opened it up in Word. Yeah.
Yeah. So it opened. Can you see my screen?
Yes.
Yeah. So here is the bones are divided into axial skeleton bone list. And then here is the appendicular skeleton bone list. We have 206 bones in our body, but we're not gonna study all of them in detail. But we'll identify, name them, most of them. So now the bones are listed here by the region, like skull. Then you have the vertebral column, like in the axial skeleton, you have a skull and the vertebral column. And then you have vertebral column, and then you have thorax. And then in appendicular skeleton, you have appendix, upper limbs and lower limbs. So pectoral girdle means pectus, means chest, girdle means extension there. And then upper limb, pelvic girder, and lower limb bones. Okay. So if you go in each section, you're going to see, let's see skull. The bones in the skulls are parietal bone, frontal bone, sphenoid bone, temporal bone, lacrimal bone, zygomatic bone, maxilla, mandible, vomer, occipital, ethmoid. These are the bones. And then there are features in some of the bone, like parietal bone. You are not studying any feature, but in parietal bone and other bones, there are sutures, sagittal, lamboidal, squamous, and coronal. So you identify these sutures too. But when you come to a sphenoid bone, there are three features you need to know: greater wings and lesser wings and turcica. Sorry, sella turcica. In temporal lobe bone, you have 5 features, and so on. If you go each bones, you have those features. Let's come to vertebral bone. Vertebral bones are by the region. Neck region is cervical, thorax region is thoracic. In the loin region, it is lumbar, and then sacrum, coccyx, and their numbers there. And there are features of the vertebra a lot here: intervertebral disc, vertebral foramen, body of the vertebra, spinous process, pedicle, transverse process, and lamina. Okay. Similarly, in appendicular bone list, you have bones and then bone marking. Like clavicle, no bone marking. You don't. That doesn't mean there is no bone marking. There are bone markings, but you don't need to know for the exam purpose. If you want to know more, study yourself from the text, from the lecture, and from the PowerPoints. Okay. But when you come to scapula, you can see there are several bone markings. You have to know these all. You will be tested on these bone markings in the exams. Okay. So this is the structure of the bone list, and we're going to go over this bone list. So I will suggest this bone list is now mine. Now, when you print out, I will suggest print it out, or you can type. Once you study, like let's say you study parietal bone, how you going to understand, and next time without opening any list, any textbook, any video from your My Lab and Mastery, anatomy lab, and you have this list, but you can visualize where is this bone and what are the features. That's why what do you do when you study parietal, right here, the bullet point feature of that bone, so you remember for yourself. You make your own feature to remember them. So next time you read this only list in 1 hour and remember all the bones. You have to do it several times. Okay. Okay, so with that, I'm going to go and I will go over each of the bones. Okay. So here, chapter 7 and 8, the axial and appendicular skeletons. In these 2 chapters, we will focus on the bones and bone features listed in the bone list. Here is the link for the bone list. Okay. Skeletons of our body consist of not only bones, it consists bones, cartilage, joints, and ligaments. Okay. Composed of 206 bones, and they are mostly, the names are by the region. Like if you have occipit region, the bone is occipital. If it is temple, then it is temporal bone. So first you think which region of the body is and try to identify. There are some exceptions, some other feature and names. Okay. So these 206 bones are divided into the central body part bone, that is called axial skeleton. They are 80 bones, and appendicular skeletons are 126 bones. So here you go. This is the frontal view, anterior view of the body. Here is the green color, axial skeleton, skull, thorax, and the vertebra. Okay. So skull has upper part, head bones, that is called cranium, and in the face, facial bones. Then vertebral column, cervical, thoracic region, thoracic, lumbar, sacrum, and coccyx. And then thoracic case has sternum and ribs. Okay. And you can see from the back those bones. Okay. And then the appendicular skeletons here, they are the upper limbs and the lower limbs. So upper limbs has the pectoral girdle, which is clavicle, scapula, and then upper skeleton, upper limb, humerus, radius, ulna, and then wrist bone is carpals, and then palm bones are carpals, sorry, metacarpals, and the finger bones are phalangettes. Okay. The pelvic girdle and lower limbs. Pelvic girdle has pelvis bones. They are made up of 3 bones. They are pubis, ilium, and ischium. And then bones in the thigh is femur. The kneecap is patella. In the leg bone, you have tibia, fibula. Fibula is also the bones in the side, and another name for tibia is shin. Okay. Then wrist bone is carpal, so the ankle bones are tarsals. Palm bones are metacarpals, so here sole bones are metatarsal, and phalanges are the phalanges. Okay, so these are the bones. Now let's talk about the bones in the, open the bone list. Skull bone, parietal bone. So in the skull bone, formed by the cranial and facial bones. Cranial bones are the head. So this is frontal bone, parietal bone, and temporal bone. This is the frontal view. You cannot see a lot of occipital bone here. And in the frontal bone, you're going to see supraorbital ridge and supraorbital margin. So you see, supraorbital margin is the margin of your orbital cavity, this margin. And ridge is here above. If you put your finger on your head here in the frontal bone where your eyebrows are, that bump is called supraorbital ridge. Supraorbital foramen, you see, this supraorbital foramen here. This foramen is for the blood vessels. And then other structures are deep inside. So other facial bones are here, like you have nasal bone, sphenoid bone, and then zygomatic bone, maxillary bone, mandibular bone. Mandibular bone is the most movable bone in your face. And there are several features in the mandible, like mental foramen. And if you go inside, then you're going to see mandibular foramen. This is alveolar socket, and there is ridge, alveolar ridge, where your teeth fit into the alveoli. And then inside bones, you can see here, ethmoid bone, then superior and inferior orbital fissures here. Sphenoid bone part only you can see. So we can go to another slide and you can see. So cranial bones formed from 8 large bones. Paired bones include temporal bones and parietal bones, but there are other cranial bones, they are unpaired. They are frontal bone, occipital bone, sphenoid bone, and ethmoid bone. A sphenoid bone lies on the base of your skull. So where your mouth is, above your mouth, sphenoid bone is lies. Okay. Ethmoid bone, you can touch your hard palate with your tongue, and the hard area in interior of your upper jaw is the hard palate that is formed by ethmoid bone. Okay. Now parietal bones and suture. So in the skull there is several sutures. You can see here these sutures. In the early life, these sutures are not fused. They are very soft. Okay. And there is gap. So you can see, like in the baby, you can see this suture not fused, not ossified. And you see like pulsation of the artery in the brain, you can feel in the newborn baby. So suture are also by the lines. sagittal suture, which is in the sagittal plane. Then you have lambda-like structure. This is called lumboidal suture. Okay. So here the lumboidal suture is between the parietal and occipital bone. And then there is occipitomastoid suture. So this is occipital bone and this is mastoid process of the temporal bone, and suture between them are occipitomastoid suture. Okay. And some of the feature of the occipital bone, which you're going to see later, you can see here. You see occipital condyle and external occipital crest. Sometimes, and then there is external occipital protuberance. You're going to see in our feature this one. Okay, occipital condyle and external occipital protuberance. Now this is inferior view of your skull. So as earlier I told you, here this is the maxilla, and this is palatine bone, palatine process, and then palatine bone here. This is the vomer of your nose, and here is part of the this one, sphenoid bone. When we take it out in later slide, you're going to see these parts of the sphenoid. Sphenoid bone is like a bat. Zygomatic bone. Here is the occipital bone, and you can see this is occipital condyle, which rests on your first vertebra, which is called atlas. And then big hole in the occipital bone is called, it's a magnum, means big foramen. That's why we call them foramen magnum. And this is external occipital crest. And this is external occipital protuberance. I think you need to know foramen magnum, condyle, and external occipital protuberance. You're going to see the list. Okay. Okay, so from lateral side, you can see other sutures too. So this suture between the parietal and temporal bone is called squamous suture. Okay, this is the temporal bones. Temporal bone has several parts. This is zygomatic process, which is attached to the zygomatic bone. And this section of the process of the zygomatic bone is zygomatic process of zygomatic bone. Pay attention here. Here are two processes. Zygomatic process of temporal bone, and this part is zygomatic process of zygomatic bone. And this together they form zygomatic arch. And in your list, you have zygomatic arch. Okay. In the temporal bone, you have opening of your external ear, that is called external acoustic meatus. Very sharp process is called styloid process, and the blunted process is called mastoid process. If you remember these features of the bone, later muscle will be easy to study because you're going to get another list of muscle next week. So make sure this week you study all the bones and you name them and know them. So next time when muscle comes, you have easy way. Okay. Then we have mandible. Mandible has the mandibular condyles and then mandibular process. This is the ramus of the mandible. This is the angle. And there is mental foramen in the mandible. Okay. This is the mastoid bone separate, and you can see this all processes here. Here you go sphenoid bone. So you see this is the skull putting in anatomical position, and you have given transverse section, removed upper part of the skull, and then you are looking on the floor of the skull in front of foramen magnum. That is like the junction of anterior and middle cranial fossa. So this bone is like a bat. See, It has wings, bat. Like a smaller wing is lesser wing, bigger wing is greater wing, so lesser wing and greater wing. And then here is cavity. That cavity is called sella turcica. And know it. This sella turcica is the house for pituitary gland. So pituitary gland lies here. Okay. And these are the three features you need to know, not other features. Okay. Here is another bone, which is on the surface of your upper palate. And this is the roof of your mouth. And in this bone, you have to know this projection like a structure of the bone that is called crista galli. And then the cribriform plate here and holes, small holes in the cribriform plate is called olfactory foramina. So from your brain, olfactory nerve passes to your nose through these holes. Okay. These are the things, three features you have to know. Okay. Crista galli attach dura mater, which is a meninges of your brain. Facial bones, unpaired bones are mandible and vomer. Paired bones are maxilla, zygomatic bones, nasal bones, lacrimal bones, palatine bones, and inferior nasal conchae. Okay. So mandible bones again, mandible condyle. This is the mandibular notch. This is the process, and this is condyle. Here, ramus, angle, and body of the mandible. And if you go medial side, each side, in this side, right side, you cannot see, but in the left side, you can see mandibular foramen. You see here? This foramen is the foramen for fifth cranial nerve, which is called trigeminal nerve. So fifth cranial nerve comes from your brain and then enter through this hole in the bone and supply half of your teeth in the mandible up to here. From this side also comes and supply half of them. So when you're doctor, we go to doctor and doctor wants to numb your teeth, to drain or clean your teeth. They put lidocaine here in this part. So they put the finger there, find this bump and find the nerve and then inject lidocaine into the nerve. So up to here, all the teeth will be numb and they can play with your teeth. Okay. That is mandibular foramen. So how many foramen? 2. Mandibular foramen is not in the list. And I want you, I don't know, let me see, it is mandible. Oh, I have mandibular mental foramen. No, it is not. So add there mandibular foramen, okay? Because this is very important. In mandible, right, mandibular, add one more. Mandibular foramen. Okay. So mandibular foramen is the opening for the somebody.
Fifth cranial nerve.
Fifth cranial nerve, which supply lower half of your teeth in that particular side. Okay. Mental foramen is for the artery, nutrient artery. This is the maxilla, and in the maxilla you see there is teeth embedded and there is zygomatic process. You don't need to worry about these things. There is infraorbital foramen, and then this is alveolar margin, means margin of the alveoli of the maxilla where you're. And when you take out this teeth, then you're going to see cavity that is called alveolar socket. Okay. Other bones of the face are zygomatic bones, form lateral wall of orbits, nasal bones, forms bridge of the nose. You don't have to know the function. You just recognize them, these bones, where they are, and know how to spell them. Okay. located in the medial orbital lacrimal bones, palatine bones. Okay. So these are the bones we talked about earlier. Now, some of the important feature here. So this is the mid-sagittal section of the human skull. And you have cut the medial side of your one side of the nostril. So you can see the medial wall of your nose. When you see medial wall of the nose, what do you see? You see there are sinuses. You see here in the frontal bone, frontal sinuses, the cavity in the bones. There is sphenoid sinus, cavity in the sphenoid bone. Pterygoid process here. So sphenoid sinus you see here. And then there is like some turbinates, the enfolding of the bones. Okay. So ethmoid bone is forming superior nasal concha, middle nasal concha, and then inferior nasal concha, which is separate bone here. And the cavity in between them are cavity, meatus, superior, middle, and inferior meatus. Do you know these sinuses? They all open into these meatus. So when you have inflammation of your nose and sinusitis, infection of the sinus, they make a lot of mucus and then drain into these sinus and then come to your nose and in your throat. And then what do? You expectorate it, or it goes into your pharynx, into your tummy, and you swallow and you eat your own mucus every time. Okay. So you are eating, recycling your own protein base, by the way, because mucus contains mucin protein and our body absorbs it and we use it. We are a kind of doing cannibalism, eating ourselves, because this is our own protein. Okay. So these are the parts of the nasal concha. When you study this, this is very important during the respiratory system. We will bring it back again. You see the sinuses? So what are the sinuses? Sinuses are small air-filled cavities in the bones. The purpose of sinuses is to make your bones lighter. Okay. So there is frontal sinus, 2 in the both frontal bones. Frontal bones at the beginning are 2. They fuse together in the adult and becomes 1. That's why they have 2 sinuses. Ethmoid air sinus, sphenoid sinus, maxillary sinus, but there is no mandibular sinuses. Okay. These all sinuses ultimately drain into your meatus of the medial wall of your nose. When there is inflammation of these sinuses, we call the disease the sinusitis. Sinusitis is the inflammation of these sinuses. And in that case, you have a lot of mucus, heavy head, and when you move your head, it builds and causes pain. Okay. Now, vertebral column, their names are by the region. So here in the neck region, they are cervical and they are 7 and they are numbered from 1 to 7. First is atlas, second is axis, and then so they all are 1 to 7. Then the posterior process of the vertebra is spinous process, and on the side there is a process of bone that is called transverse process. After the cervical vertebra, you have thoracic vertebra. They are 12 and they are also numbered from T1 to T12. Okay. And space between the vertebra are called intervertebral disc. And there is a space, lateral opening between the vertebra, and that is called intervertebral foramina. In the lumbar region, we have lumbar vertebra, and they are 5. They are L1 to L5. And sacral and coccyx are the last one. Sacral are also 5, but they are fused. And there is coccyx, they are 4, and they are also fused, the small one. Okay. So they are coccyx, sometimes it's called tailbone. If you see from the front, you can see these ones. So you see there is curved shape. So there is curvature of the our spine is not straight, there is curvature. Here, cervical curvature, thoracic curvature, lumbar curvature, and sacral curvature. Okay. This is because when we born, you are lying down and then you start crawling. There, your head goes down, and then you stand up, and then that's how this forms all the curvature. And accentuation or increase of this curvature sometimes happen with the disease, and those are abnormal condition. We're going to talk about that later. Okay, so let's take one vertebra, typical vertebra. And sometimes you have heard about herniated disc. So this is a vertebra, and to separate this lower vertebra, there is a intervertebral disc, which is here. And then you can see the long posterior process is called vertebral spinous process. This is the posterior aspect of vertebra. Then you have transverse process. And then you can see articular cartilage where superior vertebra articulates here. And then there is a disc. Disc is made up of fibrocartilage. And then there is the fibrous disc, annulus fibrous disc, and there is nucleus pulposus of the connective tissue. Sometimes what happens, you see through the intervertebral foramen, the spinal nerve is exiting. You see here? If the disc, you see there is enough space for the nerve. If this disc due to bony problem or body abnormality or any cause, if it bulges and pinch the nerve, that cause severe pain downward in your leg. And that is called herniated disc. Usually if there is mild, they with rest goes away. If there's severe, you need to do surgery. Okay. So that is the curvatures. We're going to talk about abnormality of the curvature later. So here the sacral bone has the upper part. This is called sacral promontory. Then body, first vertebra, second, third, fourth, and you see there is also holes. These are called the sacral foramina, and these foramina are for the spinal nerve going out. You can see from the posterior, and this is the wall of your pelvic cavity. So sacral promontory is clinically important because when the pregnancy and your baby is normal or abnormal position, doctors, gynecologists put the finger through the vagina and palpate this sacral promontory and find out the proper size and shape of the pelvis, whether you can easily deliver baby through the vagina or you need assistance or surgery based on the position of the baby. So this is the landmark for the gynecologist. Okay. This is the vertebra, not vertebra, sorry, the bony thorax, which is formed by the sternum. Sternum has several parts formed by several bones. You have manubrium of sternum, and you have sternal notch in the manubrium. Here is a sternal angle. This sternal angle is important because this is the landmark, because this is most superficial. You can put your finger on here and you can find out this bump, and then from there corresponding intercostal spaces, space 2. So you can find out space 1, space 2, 3, and find out which space, because fifth intercostal space is the space for your heart apex. Okay. So that is the sternum. In a sternum, you have manubrium, sternal angle, body, xiphoid process here. Xiphoid process is hyaline cartilage. And then intercostal space, and attached to it is the ribs. Ribs can be classified whether it is attached to the sternum directly, indirectly, or not at all. If they are attached directly, then we call them true ribs, like 1 to 7. See? Ribs, hyaline cartilage. Indirectly is 8 to 12. You can see they are first attached to other ribs, and then other ribs, true ribs, are attaching them to the sternum. Last two, which is 11 and 12, it is not attached at all to the ribs, and that is called floating ribs. Okay. Disorder of the axial skeleton, particularly your spine. There are scoliosis, kyphosis, and lordosis, and stenosis of the lumbar spine. So scoliosis is an abnormal lateral curvature. So let's see, if I am standing here and my curve is like slightly left or right, that is called the lateral curvature. Kyphosis is an exaggerated thoracic curvature. So if you go back, check here, you see here, so it's thoracic curvature here, it is slightly convex posteriorly. If it is more, then that is called kyphosis. That's called hunchback. And lordosis is accentuation of lumbar curvature. So you are sway back, and it happens usually with the patient who have like big belly, not fit, and during the pregnancy. Stenosis of lumbar spine is there is narrowing of the vertebral canal. So somehow there is a small vertebral canal, and that's why there is constriction of the spinal cord. Okay. So this is all the lower axial skeleton. Let's go to the appendicular skeletons. You have the bone list here again here, and we're going to talk about appendicular skeleton a little bit faster. So appendicular skeletons are pelvic, pectoral girdle and pelvic girder. Pectoral girdle attaches the upper limbs to the trunk, and pelvic girdle attaches the lower limb to the trunk. Upper and lower limbs differ in function and share the same structure plan. So upper limb is, they have like the function bone manipulation and less power, but lower limbs are very powerful. So here, upper, the pectoral girdle. So you have a scapula here, and then the humerus is articulating with the scapula. Scapula. The first is the clavicle. If you go here, this is the clavicle. Clavicle is attached to the acromion process of the scapula. This is clavicle, and it is attaching to the sternum. So this has lateral end attached to the acromion process of the scapula, and medial end attached to the sternum. The clavicle has several features. You see, there is acromial end, sternal end, which is medial and lateral. And then most important is the conoid tubercle here, which is posterior, inferior, and lateral side. Okay. Scapula, interior view. Scapula has the big fan-like structure here, like elephant ear. This is the lateral border, but I think we have to know acromion process, coracoid process, and glenoid cavity. Okay. So acromion process attached to the clavicle. This glenoid cavity, you know the name for glenoid cavity is glenoid fossa, which articulates with humerus. Another feature of the scapula is spine of the scapula. You need to know. So a student usually get confused with which one is coracoid process and which one is acromion process. Acromion continues with the spine. Okay, so remember that. AS, acromion continues with spine. If you remember this supraspinatus fossa, infraspinatus fossa, later you're going to find out the muscles name here easily, which attach here to these bones. This is the medial view of the scapula. Upper limb. So there is 30 bones from each upper limb and grouped into bones of the arm here, forearm and hand. Okay. So what is the arm bone? Without looking into diagram, humerus. What is the forearm?
Radius and ulnar.
Radius and ulna. And hand, carpal, metacarpal, and phalanges. Okay. So let's start with the humerus. Humerus has features which you need to know. The head of the humerus is his anterior view and posterior view. So head of the humerus here, which fits with the glenoid cavity or glenoid fossa. And there is a big tubercle here, greater tubercle, lesser tubercle. And then deltoid tuberosity. And here, lateral the capitulum, coronoid fossa, and lateral and medial condyles. And then olecranon fossa. Okay. So these fossas, you're going to see which one fits with the which later when we see articulates. Okay. So you see here, this is the humerus. This capitulum is the smooth surface which articulates with the lower radius and ulna. So this is capitulum. Here is trochlea. And above the capitulum, you have coronoid fossa. So when this coronoid process of ulna, when you flex and extend your elbow, then this coronoid process of ulna comes here and fits into coronoid fossa. That's why names are similar. So ulna has coronoid process, whereas the humerus has coronoid fossa. This is medial condyle. Here will be lateral condyle. This is head of the radius. And you see here, this is olecranon process. And olecranon fossa will be on the humerus. This is trochlear notch. This is coronoid process. So process and fossa, okay? Process is the name in the same bone, whereas fossa is the name where that process fits in another bone. Make that sense? So you will remember them easily. Memorize with logic, okay? So here you see again, this is the trochlear notch, and there is coronoid process. This is olecranon process. This is the ulnar process. And where it fits in the humerus is called olecranon fossa. There is a styloid process of ulna. There is a styloid process of radius. See, this is the posterior view to show you olecranon. So the cavity under here is olecranon fossa, and the process is for the ulna and medial condyle, lateral condyle. Here is radius of the, head of the radius. Okay, so these are the bones of the hand. So you see radius, ulna. This is anterior view. So in between radius and ulna, which one is in anatomical? Which one is medial?
Ulna?
Ulna is medial, yes. And radius is lateral. So in the lateral side, what do you see? Just above the radius, which bone is? Scaphoid. So there's two rows. This is the proximal row. This is distal row. Proximal row has scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. So how you remember these bones? There is a mnemonics. She looks too pretty. Try to catch her. So you see, C means first letter of each. C, scaphoid. What is next? L, lunate. 2, triquetrum. Pretty P, trapezium. Tri, 2, trapezoid. C, capitate, and hamate. And this is the posterior view. Then the metacarpals are numbered by the thumbs. So attached to the thumb is number 1, 2, 3, 4, 5 in your palm. And then phalanges are how many? In your thumb, you have only 2. Otherwise, you have 1, 2, 3. And they are called proximal, distal. This is proximal, middle, and distal. Okay. So these are the bones of the hands. Pelvic girdle attached to the lower limbs to the spine, supports visceral organs attached to the axial skeleton by strong ligaments. Acetabulum is deep cup that holds the head of the femur. Let's see the diagram. So, okay. So this is the hip bone or your bony pelvis. So we have 2 pelvic bone, right and left. This is the left, this is the right of the patient. This is the humerus, femur, tibia, fibula. So hip bone is formed by 3 bones. This upper part is called ilium. The interior portion is called pubis. And the inferior and posterior part is called ischium. When you are sitting on your chair, you are sitting on ischial bone. If you are a lean and thin person, you can easily feel your ischium. Okay. Both sides of the pubic bone attached to each other by fibrocartilage, cartilage that is called pubic symphysis. You see here. Now, here is a cavity where the head of the humerus fits. You see. This cavity is called acetabulum. In Greek, acetabulum means the alcohol cup. So in the past, there was like handmade metal cup where people used to drink alcohol. And that cup was like acetabulum. So an anatomist put the name of this cavity acetabulum. Okay. Hip bone is also called coccyx bone. So this cavity is occupied by all 3 bones. Some part of the cavity is occupied by pubic ilium bone, some by pubic, and some by ischium. Okay. There is a big hole in the ischium and pubis, between the ischium and pubis. And this hole is called obturator foramen. Obturator nerve, muscles, ligaments pass through this hole. Okay. So as I said earlier, this is the lateral and medial view of the one of the hip bone. So you see here, this is the ilium. And in the ilium, you have iliac crest, iliac fossa, and some part of the what is this called? Acetabulum. And there is ischium, pubis here. And this is medial view. This is some difference between the male and female pelvis. if you see here male pelvis, you see the outlet opening of the lower opening of the male pelvis is less, female has more. So female pelvis is roomy because female needs to hold the baby, growing baby for 9 months. That's why they have different feature, and there are some features given here. You can see them. Okay, lower limbs. So this is a structure of the femur. You can see the anterior view and posterior view. Again, the head, in the head you have fovea capitis, where nerve artery veins enters here, and the neck, like humerus, here is not tubercle, here is lesser trochanter and greater trochanter. And there is intertrochanteric crest in between them, which attach them. Then this is shaft of the humerus, not humerus, femur. Then there is lateral condyle and the medial condyle, lateral epicondyle, and medial epicondyle. So epicondyles are lower to the medial condyle. And here you will have patella. Patella is a triangular shaped bone, which is sesame, like a sesame seed like a structure. And you can see patella here. Okay. This is the bones of the foot. So this is the ankle bones, tarsals. The main bone is calcaneus, and on the calcaneus there is talus. And then from lateral to medial, you have cuboid, lateral cuneiform, intermediate cuneiform, medial cuneiform, and navicular bones. Then metatarsals and phalanges like our upper limbs. This is the medial view of the bones of the foot. So these are the bones and the body, and in the list pretty much I have gone over everything in the bones from the list. If left, you can always, when you read chapter 7 and 8, keep your printout of the bone list in front of you. Okay. Let me stop the recording and then we will